Western Cape is officially in the fourth wave of COVID-19. Now we find out how the province's health facilities are geared up given cases spike during the festive season. Let me take you to eNCA's Monique Mortlock, who is at the Somerset Hospital, to speak to us, to speak to officials there in the emergency care units in that province. So Monique, the numbers, it would seem, in terms of how infectious the Omicron variant is turning out to be. It's turning out to be quite infectious, but in terms of the severity of the symptoms, largely we've been told that those remain quite mild and people are able to cope. From the perspective of the Western Cape, monitoring the numbers on a daily basis, how are officials readying themselves to respond to the fourth wave?
Yes, we know that in the Western Cape, throughout lockdown, we've heard from Western Cape government, like our Premier Alan Winde, whenever government would implement stricter lockdowns, the Western Cape has always been adamant that a differentiated approach should be looked at when that happens, due to the difference in the rise of COVID-19 infections and the rate of hospitalizations. Right now, though, we heard just a couple of days ago that the Western Cape is in a fourth wave. We know that there are about 20,000, more than 20,000 active COVID-19 cases at this moment. There are over 400 people in hospital due to COVID-19, 45 of them in either high care or ICU units. Where we are right now, I'm just going to ask my colleague, it's quite quiet at the moment, but just to sort of show you what's happening at the moment, officials are just setting up. What will be happening is our health MEC, Nomafren Chumbombo, she will be outlining the festive readiness plan or the festive season readiness plan when it comes to our emergency care units. And we know that this is going to play a crucial role this coming festive season in the health system, because this time of the year we see high number of trauma cases, incidents relating to not only road traffic incidents or accidents, but also drownings and also injuries at home due to high alcohol consumption. And all of these incidents are things that tend to add extra pressure on health services. Now, this compounded with COVID-19 cases where people end up in hospitals, it's really going to just apply even more pressure on health workers. And this is something we're also going to be hearing from our health MEC, but not only her, also from the Western Cape Health COO, Dr. Sadi Karim, who will be taking us through just the plan, the capacity of our health system, whether the Western Cape is ready for what we are assuming will be an onslaught of trauma cases and emergency cases at hospitals like this one, new Somerset Hospital here in Greenpoint.
Yeah, and that's an important element, is it not, Monique? Given that it's not just about COVID-19 and readiness for the hospitals responding to that, we are headed up for the festive season, and there'll be a lot of travel and, as you say, a lot of trauma cases that could potentially put a bit of pressure on the system. But just your sense, Monique, of how the province is coping, even before we hear from the officials. We've seen the numbers going up. They do seem to fluctuate, sometimes reporting a higher number and at times seeming to be going down. But your sense of how it's coping with the latest figures of COVID-19?
We know that whenever we ask officials, especially over the last couple of weeks, we've been asking them, how ready are you when it comes to the high trauma incidents we tend to see come festive season time? How ready are you to deal with that on top of an influx of COVID-19 cases, especially when you're looking at our vaccination rate that's not at the level where our officials would like it to be. That target that was set by national government of vaccinating about 70% of the population, we're still far from that. And here in the Western Cape, it's no different. We know that in areas like your Mitchells Plain, your Khayelitsha, the vaccination rate has slowed down, and a lot of the attention by officials have been on ramping up those vaccination drives, on getting pop-up vaccination sites in communities like Mitchells Plain, Khayelitsha, and various other townships. And even the Hospital of Hope that used to be set up in the CTICC for those high number of serious COVID-19 cases that we saw, that was closed down, and the vaccination Centre of Hope was set up there because officials felt it was more imperative to focus on getting those vaccination numbers up to prevent any further or to prevent the high number of hospitalizations that we saw at the start of this pandemic and the middle of the pandemic, and to ensure that the health system isn't as overburdened as it was in over the last couple of months during the first wave, the second wave, and the third wave. So from what I've heard from officials, they say there are enough bed capacities in hospitals, in state facilities, and they just believe that if we can just get that vaccination rate to go up, and if we can just get more people to get that immune booster or the vaccine booster, that will help in just lessening the burden or easing the burden off of the healthcare workers.
All right, I've got to thank you for that. That's eNCA's Monique Mortlock outside the new Somerset Hospital there in Cape Town, giving us an update there ahead of the visit by the provincial authorities who are focusing on the fourth wave of COVID-19.